Hi dear friends, today I would like to describe a few features of microscope and maybe what to look for when you are planning to buy a microscope or how to set up a microscope in a basic terms or basic sense. So when you look at a microscope, right, this is called as dental operating microscope or operating microscope, we can use it, and most often it is used for procedures like root canal treatment or probably a crown preparation or maybe a complex surgery, endodontic surgery and so on. So what changes your life in terms of dental treatment? Maybe these two components which comes with microscope. One is magnification, the other is illumination. So this illumination and magnification makes it a powerful tool for you to deliver the best dental treatment possible. I have been using this microscope for a few years now, and for me I cannot do a root canal treatment without this particular tool. So coming to the parts of this microscope and just understanding what all about this operating microscope is, we have got few parts or few main components, right? The first component is, it is called as a varioscope or an objective lens, where this particular portion where you've got a objective lens which is focused onto the patient's mouth when you are doing root canal treatment or any other dental procedure. So the varioscope or objective lens is the first part, and you've got a body of the microscope where it has got something called as magnification changer. Later I will explain how the magnification changer and the fine tuning which is there, the variofocus of the microscope will act in tandem. Okay, so you have got this body of microscope where it is attached to these cables which you see. These are the cables which transmits the signal or whatever you see under the microscope to the monitor. That means you can simultaneously see the picture on your eyepiece, which I will discuss later, and also on the monitor, right? And the third main component is this particular binoculars where you've got eyepiece, right? So this is the third major component where you have got a binocular with eyepiece. So the three components together makes the major crux of an operating microscope. After understanding the components of microscope, what you do? The first thing you do is something called as parafocality, right? What you have to do is you want to be in the same pace with your assistant, right? So what you see through your microscope, through these eyepieces or binoculars, you want your assistant also to see in the monitor. Okay, so what you have to do is you have to first set up an optimal distance. For example, this particular model of OPMI, the distance, that is the variofocus, is 200 to 300 millimeter. So this particular distance you can see things clearly. That means you have a distance of 100 millimeters to play around, but it should be at least in the distance of 200 to 300 millimeter. That means the focus or the focal length of the microscope to the tooth or to the area you are working should be 200 to 300 millimeter. So that's the first thing you have to do, is you have to make sure that you adjust the height. Before adjusting the height, you may have to do one more important part, that is setting your interpupillary distance. What is this interpupillary distance? Every individual or every human being has got a distance between pupils, both the pupils, in a different set. That means everybody has got different interpupillary distance. So there is a knob over here where you can actually adjust this particular distance to your pupils. So what you do normally is you go to the largest value they have provided on this particular microscope, like for example in this case maybe 80, and you place yourself in. If you know your interpupillary distance, no problem, but for the first time you are using, if you do not know what is your interpupillary distance, this is what you can do. Like normally I know what is my interpupillary distance, so I just set it at 60, but For the first time users, probably you don't know what is your interpupillary distance. This is what I would recommend. You go there, you try to move, you place in there. First you will start watching the image with one eye. You will have two circles as we move, something like that. What your entire agenda is to make sure that you get to one circle. Once you can achieve that, you've reached one circle image, that means you have achieved what you want to achieve. That means ultimately you check your interpupillary distance, that in that you will, both the eyes are converging to become one image. That's the first thing you have to do. You can start with maybe a lowest magnification of 0.4. So once you are comfortable with the view, what you do is you change the magnification factor to the highest. That is, you go to 2.5 magnification changer, and then again you slowly adjust the magnification. So once you got these both in line, or both of them you can see what you want to see, you have achieved your magnification. You have achieved your parafocality. That means what you are seeing through your eyepiece is same as what you are seeing through on the monitor, right? So normally we don't prefer 2.5 magnification. Usually 1.6 or 1 magnification is just nice for most of the procedures you will be performing for a root canal. So once you achieve this, you are ready for doing your procedure. So what you do now is, next you make sure that this particular distance is maintained always during your procedure, because do not let any of this move. Once this moves, the focal distance or the distance from the your objective lens to the your focus area, or the area, the tooth which you are working on changes, then the whole thing will be disturbed. So this you maintain a standard, or you maintain constant. Then you can play around with this particular knob, which is used for fine tuning. This knob is basically ranging from 200 to 300. We are just managing the 100 millimeter distance in terms of what is coming through your eyepiece. So this is how you set up the magnification for your procedure. To understand the magnification, I just would like you all to focus on my hair on my finger. Here you can see a larger portion of my finger and hair over here. This magnification is at 0.4 magnification factor, and you can see that it is not so blurred, and the clarity is okay. Then when you move to 0.6, you see that it becomes a bit blurred, right? And I have to adjust a bit to make sure it is in focus. So what happens is, when you move from smaller magnification to larger magnification, there might be finer adjustments you may have to make, because the focus where we are focusing at that magnification is changing a bit. Okay, so we just make sure that now you can still focus on my hair on my finger. Now you can see at a higher magnification. Let me move to 1. You can still see that the focus is not changed, and I don't require a fine tuning for this particular thing, right? So you can see that it is still maintained in the focus, and you can appreciate that. You can see this is at, let me move to 1.6 first, so that you all can appreciate 2.5. You can see still my folds or creases of my skin fold, and also the hair follicles. You can see that they are going in different directions. Or if you want to appreciate or further move to very, very, very minor details of what we do in our root canal treatment, you can see that I move to 2.5. You can see so clearly the hair follicles. Even you can see a smallest of hair follicles possible. Now I just want to show you how your movement, if you change, how it will affect the whole thing. You see the slightest movement of my microscope. If you see on the screen, the whole thing got affected. So you should be very careful about movement of this particular thing. So this is what I was mentioning. So if there is any movement, so again you have to focus properly and slowly fine tune it. So same thing will be applied when you are doing a patient, where if there is a change in the distance of focal length, the thing will change. So you have to fine tune and adjust the length. Either you can modify the height of the patient, or you can modify, most likely we try to modify the height of the patient and slight fine tuning would do. So that's what I would like to explain about this magnification factor. Thank you very much.